Most women across the nation who are planning their baby's arrival rely on an obstetrician for delivery. But there's another option that not all hospitals are in the metro providing. The Now KC's Mackenzie Nelson explains why a growing number of moms-to-be are choosing midwives as their model for care.
When Naomi Fowler found out she was pregnant, she knew she needed to seek prenatal care.
I think just a baby is a really personal thing, and so you kind of want somebody that you get along with.
Unlike most American mothers, Naomi didn't seek out an obstetrician. Instead, she opted for a midwife.
I think it's just definitely a better experience from start to finish.
For Naomi, the decision was a no-brainer. Her mother and sisters used midwives.
I was actually her first kid that she had a midwife with, and she's like, never going back. So it was just a different experience.
Some told Naomi to go the more traditional route. Instead, she found Deb Bersano, a certified nurse midwife at Truman Medical Center, Lakewood. 17 years ago, she became the first.
But they had never worked with a nurse midwife, and so it was kind of like, what do you do exactly?
According to the National Library of Medicine, in 1989, midwives were the lead care providers in only 3% of births in the U.S. In their most recent study, it's grown to about 9%. Deb says since 2001, she's delivered close to 2,500 babies.
I've delivered babies with patients standing up. I've delivered them with hands and knees. I've delivered them on their side, and that's okay. You don't have to be laying in a bed in a certain position.
In a statement, Truman Medical Center's Lakewood Family Birthplace says each birth is unique, which is why they support and offer delivery with a midwife. In Kansas and Missouri, midwives are required to collaborate with a physician.
We know what's normal in a pregnancy and can handle that just fine. But consequently, we know what's abnormal also, and that's when we refer to the OBGYN.
Midwives only care for low-risk patients. Naomi is part of a small but growing minority of American mothers that hope more women explore that option.
Some people, I think, are old-fashioned. They don't quite know what to think about a midwife.
In Lee Summit, Mackenzie Nelson for the Now KC.